Well, it is Mental Health Monday, brought to you by LSF Health Systems. And nowadays we talk about how technology impacts our everyday mental well-being. So we've brought in Dr. Christine Caulfield from LSF Health Systems to talk to us about it, because it's not all bad. And we'll talk about that in a second. But great to see you again.
You as well.
Thank you. So what role does technology play in our well-being, in our mental health?
Well, you know, you'll hear positive and negative comments. The positives are that during the pandemic, we were able to quickly pivot to telehealth. So people that weren't able to come in person to see their therapist were able to see their therapist through telehealth. So it was a godsend, frankly.
And a game changer, really, because now that's continued.
Exactly. People got used to it and they like it. You know, some of the negative comments you will hear are the negative effects of social media with kids. In fact, research shows us that youth that spend 3 or more hours on their phones, on the social media sites, have double the risk of depression and anxiety and other mental health disorders. So not only is it affecting our youth, but it's affecting our adult population as well. So something to really be mindful of.
Right, yeah, if it's affecting us, I mean, I can't imagine developing a growing mind, right? How that can mess with you. Because we all still compare ourselves when we look at other people's lives and pictures. So imagine a child who can't, doesn't have the comprehension skills yet of knowing not to do that. It's very, very interesting. But again, not all of it is bad, though. So there are some products to kind of help with those problems, right?
Yes, yes. Dartmouth is working with a new product called Mood Capture. Now, they're going to be evaluating this and doing more research for the next 5 years. So that's a good thing.
Right.
But it's fascinating in that when an individual signs into the app and is getting ready for their session with their therapist, this mood capture captures the emotions, the facial emotions of emotions. And what the Dartmouth study is showing is they can detect clinical depression even before the client is even aware that they may be struggling with that.
That's
so
amazing. Because
more to come.
Sometimes talking it out or getting it out, it may be more hard than wearing that emotion on your face. So that's really interesting. Do you think it will be effective?
You know, the jury's out, but I think they're making good progress. I'm very glad they're going to take 5 years to really develop it and work out all the bugs.
And it could potentially diagnose, which I think is so interesting.
Yes, yes. 75% accuracy at this time. So it's something to keep our eyes on.
Does it, I think it excites you. Are there any concerns that you have maybe about this?
You know, I would be concerned about confidentiality. I'd be concerned. There are studies that are showing that with facial recognition, a lot of times there's discriminatory issues around people with color. And we certainly don't want that effect.
Of course not.
So again, looking forward to more research and working through those barriers.
Okay, well, if somebody was like, all right, 5 years, I can't wait that long, I want help now, and we do encourage that, of course, where can they go for that?
You can come to LSF Health Systems. You can come to our website, lsfhealthsystems.org, or call us on our 24/7 Access to Care line, which is 877-229-9098. There is a clinician on that other end of the phone that will connect you to the community resources that you are searching for and get you the help that you need.
Wonderful, yeah, so you don't have to wait. But I do think it's very interesting, though, that they're starting to develop apps like this. But again, we want to make sure our privacy is protected.
Indeed.
Now, really quickly, we have about 30 seconds. What is one tip you would give a parent whose child is on social media?
I would suggest limiting that time. That study with the 3 hours or more is very concerning. That causes those mental health challenges. And if you detect as a parent that your child is having some depression, isolation, sleeping too much, lots of anxiety, whatever you're noticing, and you know your child better than anybody else, let's get that child some help.
Wonderful. Well, thank you for helping us out with that today. It was great to see you.
My pleasure.
All right, David.